Yeah. Okay. I'd like to introduce Andy from Wales, and Andy has multiple sclerosis. Welcome, Andy.
Thank you.
Could you tell us, when were you diagnosed?
May 2005.
Right. And how old were you at the time?
I was 49.
49. So what was it like being diagnosed? What sort of symptoms did you have at that time? Had you had them for long?
I probably had symptoms for, I'd say, about 8 months or so, 9 months. First symptom was eyesight, really. Dimming of the eyesight when I did sort of physical work, exercise, that type of thing, which would come back eventually.
Mm-hmm.
And I suppose, close to the diagnosis, or more shortly after I had the lumbar puncture, the MS seemed to come on pretty rapidly.
Right.
Sort of signs I was getting was numbness in my thighs, and I developed a limp on my right leg, coldness, cold legs sort of thing, feet.
Mm-hmm.
And that's really how it started.
Right. And then how did it progress?
Pretty rapidly, really. I mean, within sort of 6 months of being diagnosed, I had to go at work. When I was walking, I was staggering like I was drunk. Quite depressed. My eyesight was rapidly going. Gradually going downhill. Very cold legs. A lot of numbness to both legs, really. Eventually, my hands were losing strength. Quite weak in the hands. And eventually developed the MS hug.
Mm-hmm.
People know about that. And then, I suppose by March 2006, I was partly using a wheelchair. That was my worst point, really. Depression and just suicidal thoughts.
Mm-hmm.
I went downhill so rapidly.
But it's also, as you were saying about walking and staggering as though you're drunk, it's very depressing when people assume they see somebody staggering, you're immediately labelled as somebody who's drunk, who doesn't know what they're doing, and shouldn't they know better at only 10 o'clock in the morning kind of thing.
Exactly. You just got no control over it.
No.
It's like, a bit like the dizzy sort of thing, and as I say, it's like you've probably had 6 pints, and I'd been drinking, and quite embarrassing, really.
Yes.
As I
very
say,
difficult.
I mean, after a few months of being diagnosed, I was using a walking stick. At one stage, I used 2 sticks and then into the wheelchair. It was a rapid, downhill regression, I suppose.
Yes.
To March 2006.
What kind of MS have you been diagnosed with?
Well, they couldn't sort of put the finger on, but it's primary progressive, in my opinion. Right. I haven't had any sort of relapses or that type of thing. Mm-hmm. I think it's a type of primary progressive.
Right.
Yeah.
So how did you learn about LDN?
Good question. Well, first thing I knew was there's a TV programme on our local news, BBC Wales, and a chap called Dr. Bob Lawrence from Swansea. Mm-hmm. He had a patient, a lady, who was having trouble reading. She couldn't focus her eyes on the page, and she couldn't read in books. And she started this LDN, and in a short time she was able to read books again and feeling much better. I thought, well, let's find out some more about it. So I went on the MS Society website and the chat rooms and what have you, and saw people talking about it. So I asked a few people who'd been on LDN, and I thought, well, it seems quite a safe drug, and there's nothing else available for me really, so let's give it a go.
Mm-hmm. So, did your own doctor prescribe LDN for you?
No. It was myself that had to sort of push for it, really. And, I was in the desperation stage, really. I was going down there thinking about this stem cell treatment over in Holland, and glad I didn't do that in the end. So I thought, well, let's give the LDN a try. It's a lot cheaper. Drug seems quite safe. I've got nothing to lose.
Right. So you got it privately?
Yeah, I went to the London, I can't remember the name of the company is, Medicare, something like that, I can't remember the name, but basically it's like a private consultation online. I had to register this company, And basically this doctor asked a few questions, through the internet, emails, MS questions, and then, long story short, they wrote me out a prescription, sent it to the supplier, Dixon's up in Glasgow, and so within a few days I started the drug.
And how long have you been taking LDN now?
March 2006 I've started, so where are we now? Looking at about 5 years, aren't we? Just over 5 years.
Yes.
Yeah.
So how has it helped with your MS?
Oh, massively. I mean, my eyesight's come back to probably about, I'd say, 90% good, maybe a little bit more. Although times where I do exertion, it does go a little bit, but it comes back again. In terms of the MS, I've started to get, I'm much more feeling back on my legs. The coldness is more or less gone most of the time. The strength of my hands has come back, so my eyesight's fine. I've still got a bit of a limp on the right leg. It doesn't bother me. I mean, my leg doesn't give way like it used to. I don't fall on the floor anymore. So I just have to be careful and keep myself in shape, keep fit and try and do a bit of walking and good diet, that sort of thing. So it's rapidly improved my life, and the only thing I can put it down to is the LDN, because I haven't taken any other drugs, so it's got a bit of some sort of miracle.
Do you have any MS symptoms now?
Yeah, I mean, the MS symptoms I really get is a nerve pain really to my right foot. So I'm currently trying to find drugs to ease that a bit. I think I've found one, but it's more got rid of most of the pain. It's still there a bit. I can't drive long distances in comfort. I can sort of drive about 15 miles, but on the return journey, my wife has to drive because I get a bit of pain in the right foot, especially when it's enclosed in a shoe. So, yeah, I mean, she helps out with driving. I mean, before I started LDN, I couldn't even drive. I couldn't drive for 9 months, and I'd booked up to tell you that. But no, I mean, I've got a pretty decent lifestyle now. I do okay. I mean, I have the odd day where my legs are a bit wobbly, but in general, I'm pretty good, really.
Yes. Yeah. So did you have any initial side effects when you started taking LDN?
I had the usual ones, the vivid dreams of it and a bit of insomnia. But that didn't last for too long, probably under a week. Strange dreams. But apart from that, no, because, some people get slightly worse, but it didn't seem to affect me that way. I think I started off at 3 milligrams, for 3 millilitres, and I'm up to 4.5 now.
Right.
So no real side effects as such.
Will you continue to take LDN?
Oh yeah. I mean, I don't want to rock the boat. I mean, my motto is, if it ain't broken, don't fix it, and I'm quite happy to carry on as I am, taking the LDN until this miracle cure comes along for MS. It's the best thing I've got.
So what would you say to other people with MS who are thinking of trying LDN?
I'd say try it without a shadow of doubt. You've got nothing to lose. If it doesn't work, you can come off it and you're back to as you are. I think some people give up on the LDN because they kind of feel worse initially, a few days or weeks. And my advice is just stick with it. You give it at least a month, and then if you are feeling a bit weak, lower the dose and just build up gradually. It's different with every person, the amount of LDN they can take initially, but just start gradually and build up. And my advice, it seems to work for most people. It doesn't work for everybody, but it's worth a try. It's such a treat drug to buy, and it can change your life so much.
So what does your wife think to the changes in you?
Oh God, she's amazed, because before I started taking it, we were going down the route of having rooms adapted in house, quotes for stair lifts, even things like moving to a bungalow, and
right.
big